There you go. I have the great pleasure of introducing Israel Fuentes, a rising senior at St. Joseph Notre Dame High School. A fun fact about Israel is that he's interested in learning more about medicine and enjoys spending time with family. Today, Israel will be presenting on the increase in household food insecurity due to the COVID-19 pandemic.
Thank you for the introduction. I'd like to start off by saying that the United Nations has provided a global definition of food insecurity, which is that many people do not have the access to safe, sufficient, and nutritious foods due to physical barriers like food deserts or socioeconomic factors. And it is also known that food security is known to fluctuate in times of crisis, like an economic recession, or in a pandemic. And so prior to this, my mentor, Dr. June Tester, started a study in which she was hoping to analyze the effects that a food delivery service had on lowering the food insecurity score. And so she did the study, and participants were followed up by a 6-month follow-up. And so coincidentally, their long-term follow-up coincided with the COVID-19 pandemic. So then this study was started in order to analyze if the COVID-19 pandemic had any effect on the food insecurity score. And so surveys were sent via RedCap, and responses were either recorded through RedCap or via the phone. And so, and we got our data once we graphed it. And so figure 2 shows La Clínica de la Raza study, which is a study that Dr. June did in 2018, and we'll be using this data to compare it to the BCHO study that we did recently. And so on the y-axis, you have the food insecurity score. The higher the score, the more severe the food insecurity is, meaning that the families will have less less nutritious foods, and depend more on cheap fast foods. And so the X represents the mean data. And so for the pre-intervention in La Clínica de la Raza, most families had a score of an 8, which means they had a very low food security. And then it gradually, through the B2, it went down to a 7, and then through the 6-month follow-up, it went through to 6. So this is showing us that the food deliveries were effective in lowering the food security score by a little bit, and a little difference does make a lot. And so comparing it to the BCHO study, we had a mean of around 4.5, and then it was lowered to 2. And then this marker indicates the COVID-19 pandemic. And as you could see in the follow-up, it stagnated, meaning that not as many people were able to lower their food security score. And the box and whisker plot is even more compact, meaning that the range in which people had the same scores was even greater, indicating that more families are suffering from food security. But it is important to note that this is only preliminary data, and so we can't say for indefinite that this trend will continue to be true. And I'd just also like to say that the food security score is based off the USDA's label. And so this coding sheet helped us quantify their food security. And so I'd like to thank you for listening to me, and any questions?
RedCap.
Okay, yeah. RedCap is like an online platform in which we can create surveys and then send them out through the families that are participating in the study. And it also secures and privatizes their data, so none of it gets out there.
I had a question. So once the data is all compiled and y'all finalize it, are there any plans for the data sets to be used for like advocacy efforts, or are there any specific plans yet?
Oh yeah, we're definitely looking into advocating for the low-income families that are definitely suffering through this pandemic. But we'd also like to see if the food insecurity score affected other health or risk factors. So like if they are more susceptible to a certain disease or a certain genetic disease. So we're looking into that.